Hey guys, good evening, good evening. How is everyone doing tonight? I hope everyone is having hope everyone is having a great day today. I know it's been a bit crazy. All right. Welcome to Health Tea with Dr. BDNP. Yes. Episode 9, guys. Episode 9. Episode 9. We finally made it, right? Yes. We are in the second week of November. Um so for this week or for this Wednesday, I want us all to kind of sit back and relax. Let's let's be accountable and take responsibility of our energy. It's been a lot going on. Um, I know October was a crazy, crazy month. At least I think so. It was a crazy month. And November, it's pushing close to being a crazy month, right? So I want you all to just sit down, relax, reflect. Today, I noticed a lot of things with people in the outside world, especially as it pertains to driving and things of that nature. Just take it easy, guys. Um, we got this. Don't worry. Just sit back, breathe, and relax, okay? All right. So, welcome, 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 everybody. Welcome to episode 9 of Health Tea with Dr. B. Thank you all for joining me tonight. Very thankful for all of my listeners, all of the followers, all my supporters. So, last week on Health Tea with Dr. B, the MP, we discussed insulin resistance. We received a lot of positive feedback and tons of questions, which was great. There are so many people out there who are having issues with losing weight. They're having issues with cravings. They're constantly hungry, dealing with high blood pressure, high cholesterol, sleeping issues such as sleep apnea, and elevated fasting blood sugar, which means that your sugar levels that's in your blood are constantly high, even when they are not triggered by a source such as food. So, you know what that means? They may have or be at risk for insulin resistance. So I was asked a couple of weeks ago about precise global numbers for insulin resistance. And unfortunately, we can't provide those numbers because insulin resistance is often underdiagnosed or it's unrecognized until it progresses to more serious health issues like type 2 diabetes or heart disease. However, insulin resistance is generally understood to be a widespread health issue, particularly in places with high rates of obesity and sedentary lifestyles. So, here in America. But, guys, please do not play around with your health, okay? Check your insulin levels. I know all of my patients get their levels tested right through the door because it is a necessity. And remember, if you are in Maryland, Washington, D.C., Colorado, New Mexico, Washington State, and now Utah, and you're seeking treatment, the link is in my bio. You know what you need to do. You know you need that consultation. I have acquired a ton of new patients, and I'm so happy for them because when they choose me, it's because, I know that they're choosing themselves when they choose me. Because at the end of the day, I promote advocacy in all ways throughout your health journey. Okay? All right. So, again, as a reminder, on November 18th, I will be hosting Health Brunch with Dr. B. Super excited. It will be in Maryland for all of my out of towners. Invitations have already gone out. We will be discussing all hot topics regarding health, eating, and just simply having fun because I'm fun to be around. So, I hope to see you there. Also, if you would like to be a guest on the show to share your experiences or ask questions, please send me a message directly on Instagram or Facebook and send me a message or send me a message at bit.ly/health tea with Dr. B. Now let's move on to episode 9, Sugar's Shadow, Illuminating the Darker Side of Diabetes. And as usual, I have some hot tea for y'all tonight. Now, you guys know that I introduce a tea every week that is usually connected to our topic of the week, and it's usually loaded with benefits. So, this week's tea is Oolong Tea by Allegro. Oolong Tea. Hopefully, you guys can see this. Ooh, let's see. There we go. Bam. Allegro tea. There we go. So, oolong. If you would like to get this tea, the link is in my bio. But let's discuss oolong tea. And I actually have some in my cup right now as we speak. So, oolong tea is a traditional Chinese tea that is partially fermented. So, it is placed somewhere between green tea, which is not fermented, and black tea, which is fully fermented. So, it's right there in the middle. Okay. It has several potential health benefits, and particularly in the context of diabetes and insulin resistance. Okay, so here we go. Here are some of the noted benefits. Blood sugar regulation. So, there are some studies that suggest that oolong tea may help to regulate blood sugar levels, which is crucial for individuals with diabetes. All right. And I do remember from our tea last week, I think it was black tea. Same kind of effect with the antioxidant effects. So, just like black tea, oolong tea is rich in polyphenols, which are natural antioxidants. All right, remember that antioxidants can help mitigate oxidative stress, which is associated with insulin resistance and the progression of diabetes. Now, let's move on to the metabolic benefits. So, drinking oolong tea may boost metabolism and fat oxidation, which can be beneficial for people with metabolic syndrome or those who are pre diabetic, potentially helping them to prevent the onset of type 2 diabetes. So, think about that now. Weight management. So, of course, you know that obesity is a significant risk factor for the development of type 2 diabetes. So, the metabolism boosting effects of the oolong tea can definitely assist with weight management. Therefore, it can help to prevent diabetes and manage insulin resistance. And of course, we have our famous anti inflammatory properties. So, chronic inflammation, remember, it is linked to the development of insulin resistance. So, if you're constantly complaining about knee pain, or you're picking up weight, or you having gut issues, I'm sure you have inflammation. Any inflammation that is long term, also known as chronic, it will be linked to the development of insulin resistance. Okay. And then my favorite topic of all, PCOS. So oolong tea is beneficial for polycystic ovary syndrome, also known as PCOS. So women with PCOS often have insulin resistance, and oolong tea might improve insulin sensitivity in these patients, although studies are limited. I have PCOS, so I drink a lot of teas to help decrease my insulin resistance. Okay, so here's what I always want to point out on each show. It is important to note that while oolong tea or any tea that I promote here, while it may be beneficial, it should not replace any medical treatment for diabetes, insulin resistance, or any treatment that you are receiving from a medical professional. Remember that these teas can be a complement to a healthy diet and lifestyle that includes regular exercise and proper medication as prescribed by your healthcare provider. So I repeat, do not stop any of your medications, your regimens because of tea. Always consult with your medical professional first. All right. So you guys got that. So let's move on to episode 9. And now we can sip, listen, and thrive. Oh, thank you. All right. Sarah asked me where I got my cup from. So here's a crazy story. This is not my cup, guys. And for a few weeks now, you guys see me with this cup. I'm going to have to put you guys on to my sister. My sister actually gifted this to my mother, who doesn't know that I'm using this. Okay. I love her cup so much, and I have been showcasing it everywhere, but this is her cup. I'm going to ask her where she got it from so I can post a link for you guys. So, and the tea isn't bad, guys. I didn't give my thoughts about it. It is not bad. It is warm. I'm freezing. It is doing all the right things it needs to do right now. All right. So today we are going to discuss diabetes and the many faces of it. Okay. So we all have heard about the infamous diabetes. We have had family members diagnosed with it. We know at least one person with it. And quite honestly, a listener out there already has it and doesn't even know it. So today we're going to talk about the complexities of diabetes because it is time for all of you to become aware and take charge of your health. So, what is diabetes? Diabetes is a chronic condition associated with abnormally high levels of sugar, also known as glucose, in the blood. It occurs due to either an inability to produce insulin, so that's the hormone that's responsible for regulating blood glucose levels, or the body's inability to use insulin effectively, or both. So, more specifically, type 2 diabetes, which is what we'll discuss today, affects 33 to 35 million Americans and is the seventh leading cause of death in the United States. Just yesterday, I read about a popular rapper who died due to complications of type 2 diabetes. So, this is serious. This condition is nothing to take lightly because I have seen and I know of so many people who are either suffering with the complications of diabetes or they've died. So, this is nothing to take lightly at all. So, here is some early brew tea. Who in here knew that there were several types of diabetes? Like over 5 types of diabetes, right? That's the tea, because I don't think anyone knew that it was over 2 or 3. Mainly, people think that it's only 2 types because we always hear type 1, type 2. We never hear of type 1, type 2, type 3, type 4. We never hear that. But we will discuss that today. So, starting with type 1 diabetes. Type 1 diabetes is an autoimmune condition where the body's immune system attacks and destroys the insulin producing beta cells in the pancreas. So, people with type 1 diabetes produce very little or no insulin, and it typically manifests in childhood or young adulthood, but it can occur at any age. Excuse me, my tongue is getting tied. And management usually includes lifelong insulin therapy. So, I've seen children, I'm sure you've seen a lot of people who have an insulin pump and they rely on their pump. Okay? Type 2 diabetes. The most common form of diabetes and the one that we are going to focus on today. So, type 2 occurs when the body becomes resistant to insulin, hint, hint, insulin resistance, or doesn't produce enough insulin. It's often associated with genetic factors and lifestyle risk factors, such as being overweight and inactive. But here's the thing, type 2 diabetes can be managed with lifestyle changes, oral medications, and sometimes insulin. Okay, so it's not a death sentence. It's not something that you're going to be stuck with for the rest of your life. Okay, and now here come the good ones, gestational diabetes. So this type occurs in some women during pregnancy when the body can become less sensitive to insulin. And although it usually resolves after giving birth, it increases the risk of developing type 2 diabetes later on in life for both the mother and the child. Okay? And then we have prediabetes. This is a condition where blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. So remember that prediabetes is a risk factor for type 2 diabetes, heart disease, and stroke. And we will discuss the T on this later. Okay? And then we have maturity onset diabetes of the young, also known as MODY. So it's a group of monogenic diabetes forms. MODY is caused by a change in a single gene and can often be mistaken for type 1 or type 2 diabetes. So it usually appears by the time a person is 25. So that's confusing. MODY can be confusing for a lot. Okay. And then we have a latent autoimmune diabetes in adults, LATA. It is sometimes referred to as type 1.5 diabetes. So, LATA is a form of type 1 diabetes that occurs in adulthood and typically after the age of 30. And it progresses more slowly than childhood onset type 1 diabetes. I know most recently throughout this year, I have diagnosed many adults with type 1.5 diabetes. And then we have secondary diabetes. So, this type is a consequence of other medical conditions, such as cystic fibrosis, hemochromatosis, or disease of the pancreas, or the use of certain medications. So, let's think about those who are on steroids like prednisone or antipsychotics. So, those who are on those medications for long periods of time, they are now forced into the diabetes world, okay? Because their sugars are always going to be elevated, and now their A1C is also going to go through the roof. All right. And then lastly, we have monogenic diabetes, which is a rare form which includes neonatal diabetes and MODY, and it results from mutations or changes in a single gene, and it is often mistaken for type 1 or type 2 diabetes, but does not require insulin resistance, or excuse me, insulin treatment. Okay? So I just named a lot of them out there. So just make sure that you had your pen and your paper because there's so many of them, okay? But today we're going to focus on type 2. But I wanted to discuss more about prediabetes because someone asked me a question on one of my reels the other day. They asked why I do not believe in prediabetes. Well, here's the tea. Usually by the time you are pre-diabetic, which means that your hemoglobin A1C is 5.7 or higher, it means you most likely were in insulin resistance or had metabolic syndrome, which had already opened the door to prediabetes and diabetes. So I do practice functional medicine, which means that I deep dive to ensure that conditions stop or halt before it even starts. Okay. So no, I do not believe in prediabetes. I believe that you either have it or you do not. Mainstream made that term, and many people were comfortable with it, right? So when they come into my office, they say, "Oh, I'm only pre diabetic. I'm not there yet." When in reality, they are there because nothing has changed. Unfortunately, nothing's changed. So that is the problem. That's why I do not believe in pre-diabetes. It's either you are diabetic or you're not. Because remember, at the end of the day, we have sugar or glucose in our blood, and it does not belong there. It doesn't belong there, especially not in high amounts. So if it's there, that means something is festering. Early organ damage is playing a role here. So the blinkers are on now. Okay. So, what are the signs and symptoms of diabetes? We have fatigue, which means that you're tired all the time. And I know a lot of people who are tired all the time, and they always say that it's just life getting in the way. Significant hunger or thirst, also known as polyphagia and polydipsia. Frequent urination, especially at night, that's known as polyuria. Blurred vision, dizziness, slow wound healing, tingling, numbness, or pain in the hands or the feet. That's known as neuropathy, but that usually means that you have a nice severe case of type 2 diabetes. It's already set in your system, okay? Frequent infections. So let's think about someone who gets frequent yeast infections or UTIs. That's you, right? I know. Think about, hey, I get about 10 yeast infections a year. I get at least 8 to 10 UTIs per month. Let's check your hemoglobin A1C. Let's check your urine. Is there sugar in your urine? Okay. And then unexplained weight loss. Now, this one doesn't make sense to a lot of people, but when the body is unable to use sugar or glucose effectively due to the lack of insulin or due to insulin resistance, it starts to break down fat and muscle for energy, leading to the weight loss. Okay, so that's how you can have weight loss or drastic or unexplained weight loss and still have diabetes. And then areas of darkened skin, usually around the neck and around the armpits. So that's known as acanthosis nigricans. Okay, I remember when I first learned that term, I felt like I seen at least 80, 11 people with dark patches on their necks. And I kept saying, "Oh, you're at risk for diabetes." And although they thought I was that annoying child, I was right. And it's because in our community, no one went to the doctor. So no one got this stuff checked out. So here I was looking at everybody. Oh, I see a dark patch. I see something. I see dark skin. It's on the neck. So yeah, get yourself checked because those are the signs and symptoms of type 2 diabetes. So what labs suggest diabetes? So we discussed last week fasting insulin levels. So a fasting insulin level of less than 7 is ideal. When it is greater than 7, it pushes you into insulin resistance. Okay. So insulin levels greater than 7. Hemoglobin A1C, that is a level that checks to see how you've been doing for the past 3 months. So, according to mainstream, prediabetes starts at 5.7 and goes to 6.4, and diabetes starts at 6.5 or higher. I have had people come in with an A1C of 7 for years, and they have no treatment and no education. They were told that they just had to lose weight and then everything would be fine. Okay. Lipid panel, also known as the cholesterol panel. Okay. So looking at the glucose level, the fasting glucose level, how is that? If you're fasting, that means you're not eating, you're not triggering a response, but now your blood sugar is at 150 or 200 without food. That number should be less than 85. Okay. So those are the numbers to kind of focus on when you're looking at your blood work. And now, what are the risk factors of type 2 diabetes? So it's about to get fun. So we have obesity and overweight, right? Go figure. Being overweight or obese increases your risk for developing what? Insulin resistance, which can then do what? Lead to type 2 diabetes. So you see how there is a cascade, there's a domino effect. It doesn't mean that everyone who is overweight or obese will have insulin resistance. It just means that you're at risk for it. Having a family history of diabetes. So sit tight with this one because I'm going to break it down. All right? Because a lot of people said, man, if my grandmother had it, then I'm going to have it. So having a family history is a significant risk factor for type 2 diabetes due to the combination of genetic and environmental components. Okay. So when diabetes is common in a family, it does suggest that there are specific genes being passed down that increases an individual's susceptibility to developing the condition. So here is why family history plays a very crucial role with type 2 diabetes. So we have the genetic predisposition. So there are specific genes associated with insulin resistance, and beta cell function can be inherited. So if these genes are less effective at managing blood sugar levels, that means the risk for developing type 2 diabetes is higher. Okay. And now we have shared environment and lifestyle. So families often share the same dietary and exercise habits. And then these lifestyle factors can contribute to the development of diabetes. So, for instance, if a family has a pattern or of behavior that includes a diet that's high in calories and sugar and low physical activity, then this can increase the risk for obesity and type 2 diabetes. So, see, we linked it already. Okay. And now, being African American, American Indian, Asian American, Hispanic, Latino, or Pacific Islander. These are risk factors for type 2 diabetes. Now, being sedentary, yes. Lack of exercise and a sedentary lifestyle can contribute to insulin resistance and lead to type 2 diabetes. Okay? Having prediabetes, we just discussed this earlier, can lead to type 2 diabetes. Having gestational or having a history of having gestational diabetes, which is diabetes during pregnancy. And then poor diet. So, a diet high in refined and processed foods, sugar, and unhealthy fats increases your risk of developing type 2 diabetes. So, we have a good question. We have a good question. Actually, this person sent in the question about a few hours ago, once they realized what the topic was going to be on tonight. Are diets hereditary? So this is a good question. Let me sip my tea on this one. It's a good question. So diets themselves are not hereditary in the way that certain traits or genetic conditions are, because they are not directly passed down through DNA. However, dietary preferences and habits can strongly be influenced by one's family and cultural backgrounds, leading to patterns that may appear to be inherited. All right, so let's think about it. When I did community health and I went to certain areas of Baltimore City, I looked around and I saw what foods were available. I saw supermarkets that were not available. It was probably one every a lot of blocks, not, a few blocks, a lot of blocks. Maybe one in the neighborhood, and sometimes it was closed, right? And I thought about what a person may eat. You eat what is available to you, right? So, thinking about these families and their socioeconomic status, the foods that were available to them influenced their diet across generations. So, if there's only food that's high in sodium, fried foods, processed foods, then guess what? You're going to be raising kids with those foods. Those foods will then go to their kids and then their kids, especially if they stay in the same area. So that's availability and socioeconomic status. Okay. And then we have cultural practices. So remember, diets or dietary habits can be familial, though not hereditary in a genetic sense. So cultural practices, diets are often shaped by cultural practices which are passed down from generation to generation, which is great sometimes. So this includes the types of foods that are commonly consumed, the cooking methods, and even how and when the meals are eaten, right? We have learned behaviors. So children learn by observing and imitating adults. And if parents or family members have specific dietary habits, then those children are likely to adopt similar habits. And rightfully so, this is what they know. And then food preferences. Taste for certain foods, certain types of foods, okay, can be developed early in life based on what's commonly served in the household. And these preferences can have a lasting impact on an individual's diet, okay? And then health beliefs. So, attitudes towards health and nutrition are often shared within families. So, if there's a strong belief in the health benefits of a certain diet, like vegetarianism, for instance, this can be adopted by multiple family members and across generations. So you'll be surprised about how contagious that is. So if one family member eats pork or doesn't eat pork, let's do that one, then most likely the whole family won't, because that's not what's been passed down. Okay. And then cooking traditions. So culinary skills and recipes are often passed down through family members, influencing the types of meals prepared at home. So, thinking about our grandmother's cooking, right? And think about when grandma was born. Think about like the different ingredients that they had back then. What ingredients did they have back then? Cooking in lard, It was a lot of things going on back then, right? And then what is another saying that we always hear about? Southern cooking, right? So imagine, I want to draw their blood levels really badly just to see. I would love to just see. Okay. So that's why when we spoke about Asian American, Hispanic, Latino, African American, when we think of those cultures, let's think about the foods that come with, right? Are the diets high in carbohydrates? Are they high in sugars? So there's so much. There's so much to really digest from that. So, how can it be treated? So, of course, we know the obvious that is always mentioned to us, and that's diet, 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 right? But the T is, are you really compliant with your diet? Have you changed your ways? Because we all roll our eyes and suck our teeth when we hear someone says, oh, you have to lose weight by going on a diet. I know I hate hearing that. Now, I haven't heard it in a really long time, but I've heard people say that to others. And it can be really frustrating and you can become down. But the truth is, how are we able to succeed if we are not compliant or being accountable for our diets? And that's a real question. So, a lot of my medical providers, when I ask them or when we talk about certain things, I say, well, if this person had prediabetes, insulin resistance, or type 2 diabetes, have we educated them on what diets were the best? Did we refer them to a nutritionist? Nutritionist sounds like a thing that's, far in between. I can't afford that. But truth is, insurance covers a nutritionist. And honestly, people put money towards things that matter to them. So if we made health matter, then I'm sure we'll be seeing a ton of healthy people all over. Okay. So let's talk about diet. So nutrition plays a critical role in managing type 2 diabetes. So one needs a diet that ensures adequate protein, healthy fats, and emphasizes whole, organic, nutrient-dense, low glycemic, and high fiber foods. So the one where you guys didn't hear me say yet was carbohydrates. So there's a lot of controversy behind carbs, right? When we discussed insulin resistance last week, I said, hey, cut your carbs. I still stand by it. Okay. Why? Because carbs really do turn into sugar when not processed well, especially if you overeat carbs, right? Because there's no more that's being used for fuel. It's now being stored as fat. So when we're wondering why we have fat around our waist, or we're just bloating and getting bigger by the day, it's because of the carbs. So I still stick with cut your carbs, not drastically, but cut them. But now improving your protein and your good fats. When my patients come to me and they're stuck, I actually give them a diet plan with the foods that they would enjoy. High in fats, the protein, and I match it to their activity level. Okay? So, diet and nutrition is great. Low glycemic and high fiber foods are important because they minimize blood sugar spikes and supports better blood glucose control. Okay? So, when we talk about low glycemic, let's talk about the fruits, low glycemic fruits. The berries, strawberries, blueberries, blackberries, raspberries, right? My patients love them, and I say, please have that. But please leave the citrusy foods alone. No pineapples. It's going to spike your sugars. Okay? Moderation is always key, but it is about consuming low glycemic, which is low sugar foods. Okay? And I just described the fruits that are low glycemic. So, a specific dietary approach with evidence to support its benefits for type 2 diabetes is the Mediterranean diet. Now, I've never been on the Mediterranean diet before. I've done keto, I've done low carb, I've done a lot, but I've never done the Mediterranean. But I have a lot of patients who have tried and they were successful. So, a Mediterranean diet has been shown to support better blood glucose control and a healthy gut microbiome, which is an important consideration for those struggling with type 2 diabetes. Another nutritional approach to consider is intermittent fasting. So I do come with this disclaimer. Fasting does not work for everyone. I actually perform specialized testing in the office, which actually opens the door and it lets us know if a person should be fasting. Okay, it lets us know if they should be fasting and for how long, or if they should be fasting at all. Okay, so remember that this is not a one size fits all approach. These are just some ideas that I'm throwing out there. So I said keto, I said low carb, Mediterranean, the DASH diet, and now intermittent fasting. Here's the thing with intermittent fasting. You cannot just throw yourself into fasting. It is a process. So you have to be patient with yourself. Okay, be patient with it. So with intermittent fasting, it can help reverse or manage type 2 diabetes by improving glucose control. Fasting regimens may vary. So there are some people who do alternate day fasting, which means they eat one day and then not the other, or they have a time restricted fasting. So I used to do OMAD. So I did one meal a day, 18-6. So there's a lot where you can fast for a certain amount of hours and then eat during your fasting window. But fasting has been shown to reverse insulin resistance and improve blood glucose levels. So a fun fact of me from last year, last October, I did do the keto diet and I ate. I really did eat. I ate and I did fasting. And guess what? I lost 31 pounds. I lost 31 pounds and my numbers reversed tremendously. And I felt great. My skin was clear. Everything was great. So it works. But if you need help, please reach out to a medical professional or nutritionist. And there are nutritionists online. Faynutrition.com, I believe. I believe that's the website. Please. Okay. So we've had diet as far as controlling or managing type 2 diabetes, exercise. Do something that your body is not familiar with. So if you're normally sitting at the computer, right, and you're sedentary, start walking. Walk 5 minutes more each day. Start walking up the steps every now and again until your body gets used to it. When your body starts to notice some activity that they've never had before, the weight will start to drop. It works. So exercise is imperative. It's important. Walking 30 minutes a day. Try to split it up. If you can't do 30 minutes in one sitting, 15 minutes here and there. There's YouTube with walking videos. Walking in place serves a nice purpose. Now, I've done walking in place for a while. I loved it because I can do it in the comfort of my own home without worrying about how the weather is going to be outside. Okay. And then, of course, we have our medications, right? We have our oral anti-diabetics. So that's our metformins, our glipizide, glucophage, right? We have our GLP-1s like Ozempic and then Mounjaro, Saxenda, Trulicity. There's a lot of them that's out there. Januvia. So many of them that's out there. Okay. But we're trying to teach you on how to not get there. Okay. And there are insulins. There are some people who are controlled with insulin. So Humalogs, Novalogs, okay, Lantus, Levemir. There's a lot. Those are insulins. So my purpose here isn't to teach you about those medications. It's about you advocating for yourself on how you can reverse this condition, how you can manage it, right? Along with your medical professional. So here are some supplements that I hold dear and near to my heart because the goal is to improve blood sugar levels and insulin sensitivity and to modulate the immune system. We need all of those things to keep us together. So chromium, okay? So chromium is a trace mineral that plays a role in insulin action and glucose metabolism. So studies show that chromium improves glycemic control, reduces insulin resistance, and lowers fasting blood sugar levels. Sometimes people take 200 micrograms up to 3 times a day, and they take it for about 4 to 25 weeks. It's a long time, but it works. Magnesium. Magnesium deficiency has been shown to increase the risk of diabetes. So supplementation can help to protect against inflammation and improve markers of blood glucose control and insulin sensitivity and lower blood pressure. So magnesium. And one of these days we're going to have a live on the different types of magnesium because there's like so many different types. But usually 300 milligrams daily of magnesium for about 3 months usually does the trick. Vitamin D deficiency, which has also been associated with autoimmune diseases, including type 1 diabetes. So supplementation has been proven helpful in treating autoimmunity. Okay. And it looks like they calculated a risk reduction of 15% with vitamin D supplementation, and that's between 4 to 5,000 international units daily, and it's on a daily basis. Vitamin D3 to be exact. And then we have our lovely ashwagandha, which is an adaptogenic herb, which is used historically to assist with stress, neuroprotection, and inflammation. Okay, it effectively treats chronic stress and hypothyroidism, which are known contributors to autoimmune disease. Okay, and with ashwagandha, be very careful. I've met a lot of people who've overdosed on ashwagandha, and that's because they were taking it wrong. They were taking 1,000 milligrams up to 3 times a day, usually 500 to 600 daily in split dosing for 8 weeks. Usually is best. Okay. I'm also a big fan of berberine, myo-inositol, cinnamon. But here is what I say always. Please consult with a medical professional first. That's why my consultations are open, because you need a medical professional who's going to understand you and your goals and what you are trying to do. It is not safe to take 11 supplements at one time. You have to figure out what your goals are. These are things that could help, right? But it doesn't mean that you have to turn into the pill lady. Now you have 25 supplements, because now we have to worry about your kidneys and then your liver, because your liver metabolizes and your kidneys excrete everything out, pushes it out of your system. So we have to be super careful about that. Okay, that's why consultation is the best. I'm just letting you know why certain things are great. All right. So even with the berberine, if you're on metformin, please do not take metformin along with the berberine. All right. We don't want you guys out there having hypoglycemic episodes, which means low blood sugar. We don't want that. We don't want that. Okay. So consult with someone first. My inbox is always open. All right. So is diabetes reversible? I actually had a question. Maybe yesterday, someone just followed us on Health Tea with Dr. BBMP and my clinic, True Phoenix Community Care, and they said, my doctor said that if both of my parents have type 2 diabetes, then I'm not at risk. I already have it, and I will have it for the rest of my life. So, what did we mention earlier? We mentioned that family history of diabetes puts you at risk. Doesn't mean that you will have it. And if you do have it, doesn't mean that you will have it forever. There is a such thing as reversing diabetes. There is type 2 diabetes. Flag on the play. Type 2 diabetes. That's what we're discussing today. So if you have type 1 diabetes, this is not the conversation for you. This is for my type 2ers. This is for my pre-diabetes, my insulin resistance. That is reversible. That is not autoimmune. That is environmental related. It's diet related, exercise related, insulin resistance related. Yes, it is reversible. I don't want you guys to think that you are a slave to this. But what we are noticing out there in the healthcare streets is that so many people have these conditions. I'm seeing way too many amputations. I'm seeing way too many surgeries for those who are unable to see. They've lost their vision because of diabetes. It makes me feel like I should put on my cape and try to help save the world some way, somehow. But I'm only one person. This is the reason for this podcast here. I want you all to know about these conditions, to know that they exist. I want you guys to match your symptoms. If you have questions, what medical professional you know has their inbox open for questions all the time for free, right? Ask questions, because it's real out here. I want you all to thrive at all times, okay? At all times. So hopefully you all have learned definitely about diabetes. I prep so hard for these lives here because I always want to make sure that I'm not giving too much, but that I'm also giving enough for you to take home and digest. Because when you guys come into my office or you call or you leave me a message in my DMs or on the reels that I try to put out there, these are really good questions. I want you to say, hey, my A1C has been 7 for 8 years. I now have numbness and tingling. I want to be able to say, hey, you need help. You need help. And it's okay. You know, my goal is to try to help pick up from where mainstream dropped you off at. Not everyone is failed by mainstream, guys. So I'm not here to bash mainstream at all. I'm not here for that at all. I'm just trying to give you guys other takes on your health to let you know that no one else is in control. You are. That's your body is your temple. Your body is your teacup. Take care of your teacup, guys. Take care of it. All right. So today was pretty long one, 46 minutes. I'm always elated to be here every Wednesday. But next Wednesday, we will not be here because on November 18th will be Health Brunch with Dr. B. So we will be prepping for that. Pictures to follow, okay? And there will be some videos of the different conversations that we will have for that particular day. So no health tea with Dr. B next week. It'll be the following week, a day before Thanksgiving. And guess what we're going to talk about? Weight loss, right? How appropriate. So, yes, you'll learn about weight loss a day before Thanksgiving, which is fine because guess what? Life is always going to be there. You will just need to know how to control it, right? How to manage it. How can you have fun with your life? And do you want to lose weight? Are you ready to lose 20 pounds? Hmm? Are you ready to join me for my December madness? That's what I'm going to call it. December madness for losing weight. All right, so stay tuned 2 weeks from now because next week there'll be no Health Tea with Dr. B. But thank you all once again for joining. If you guys have any questions at all, please request a consultation. Visit bit.ly/health tea with Dr. B because now you sipped, you listened, you thrived, and now here you are. Thank you all for your support. Okay. Thank you all for attending this show. Those who have been attending the show literally every week, thank you, thank you, thank you. Please follow us on Facebook, follow us on Instagram, and on YouTube. We are there because these videos stay posted. Okay. You guys are the reason for why I do what I do. I am forever grateful. You guys have a safe night, a safe November. Remember to just sit back, relax, and reflect. Do not let anything bother you guys, okay? It's that time of the year where things are going a little crazy. All right. So you are in control. Remember that. All right, guys. That was the tea. I am out. Take care.